original authors. So please join me Wednesdays here on 90.9 FM KSJE Farmington.
KSJE is supported by San Juan Regional Medical Center, here to meet your urgent and emergent medical needs, whether they are COVID-19 related or not. Medical emergencies happen when you least expect them, whether it's a stroke, heart attack, illness, or injury. San Juan Regional Medical Center's caregivers are here to provide care to you and your loved ones. Find out more online at sanjuanregional.com. "11 minutes past 8 o'clock. It is Wednesday morning, May the 12th, 2021. Good morning, everyone. I'm Scott Michlin. Thanks for tuning in to KSJE 90.9 FM over the air here in San Juan County, New Mexico. 103.3 FM over the air in Durango, Colorado, and streaming everywhere from our website at KSJE.com. Welcome also to our viewers. This is a visual radio program, of course. The video is streaming live to the KSJE Facebook page, our YouTube channel, and our Twitter account. Welcome aboard, everyone. We're glad that you are with us because coming up in the next few moments, we are learning all about nurse navigators with my guest from San Juan Regional Medical Center, San Juan Health Partners Internal Medicine. So we'll be talking with Michelle Russo in just a moment here on KSJE, so stay tuned for that. Then, of course, later on this hour at 8:50 a.m., we hope you will be still tuned in because Dr. Mike Hadabaugh is sharing some more good words of advice from the Encouragement Lab. That is coming up later on this hour right here on KSJE. Next hour, 9:06, it's our classical music program, Roving with the Arts, and Mick Hess is speaking with one more local favorite today, and that is Charlie Decker. Charlie is a trumpet player, and he is a retired trumpet professor, by the way, who lives now in Tennessee. Be talking with him coming up today at 9:06 on our local favorites portion of Roving with the Arts on KSJE. That'll take us to 10:30, right on Four Corners, our local and regional author program. Tracy Hales-Vass is speaking with author Christina Ersek. She is the author of this book called The First Lady of Under Fashions. Learn more about that coming up today at 10:30 a.m. on KSJE's Right on Four Corners program. Don't forget, of course, we invite you to connect with us on all forms of social media. Whatever works for you works for us. You can check us out on Facebook, subscribe to our YouTube channel. You can follow us on Twitter, of course, and also check out KSJE on Instagram as well. Outside our studios at the moment, it is a sunny Wednesday morning. Current temperature 48 degrees after a clear night last night. We are expecting a mostly sunny day today with a high of 75 degrees. Tonight's low down to 41. Sunshine again tomorrow with a high of 82 on Thursday. Clear and 47 tomorrow night. It'll be 84 and sunny on Friday. 49 for a low Friday night, a bit cooler on Saturday with a high of 82 with lots of sunshine and 80 by Sunday, and maybe a few showers moving in on Monday and Tuesday of next week. We'll keep an eye on that and let you know how that storm system shapes up. But that's the forecast for the next several days, sunny and mild, beginning today. Let me turn to my guest, who is here with me this morning. As I mentioned, the nurse navigator with San Juan Health Partners Internal Medicine. Michelle Russo is here in the studio with me this morning. Good morning.
Good morning, Scott.
Thank you for coming in this morning.
Thank you for having me.
You bet. It's great to have you here to tell us all about the job that you do as a nurse navigator with San Juan Health Partners Internal Medicine. And so to begin with, I guess, explain to those of us that maybe aren't as familiar with what a nurse navigator is, what it is that you do.
Okay, well, again, thank you for having me this morning, and good morning, San Juan County. I'm so glad to be here to talk about what I do. I'm a registered nurse, and this is a newer position for nurses in kind of an outpatient clinic setting. Historically, we've worked inpatient, emergency room, hospital setting, and now you're going to find nurse navigators out in our family practice settings, primary care settings. And we've been put in place to basically get in touch with our community, find out what our resources are for patients. We come alongside our providers and we team up with our doctors and nurse practitioners just to help promote wellness to our patients. And then the primary reason we're set in place is to support our patients. We're here to increase the health literacy of patients, help them understand their medications, help them understand so many different aspects of our healthcare system that are kind of challenging these days.
Interesting. And so when you talk about health, I mean, I think you're talking about maybe overall health, not necessarily medical health, but other things too that maybe you can help folks with?
Oh, goodness, yes. So a lot of preventative kind of things we focus on. We want to keep folks healthy. We want to keep them independent, and we want to keep them in their homes. That's what my patients, that's what their goals are. And so we help them understand just a lot of the different resources that are available to them, and just come alongside and meet them wherever they are at with their health.
Got you. And so I guess the term navigator just, it means kind of a guide almost to just help your patients through some of the more complicated world of medicine these days.
Yeah, that, with a navigator, we can help expedite things. Traditionally, or kind of where this, the philosophy of where this is coming from, this position is called population health nursing. So we're taking basically a population of our health folks. We're kind of identifying some of our high-risk patients with multiple chronic illnesses that can use someone to just help them understand either their chronic illness, their medications, or the resources that are available to them, in town. And so as we do this, we develop this relationship with patients. We build trust. And as we do that, they begin to kind of buy into what it is the doctors are really wanting for their patients to do. The doctors always want these best practices for them, but patients don't always quite understand that, in a quick 15 or 30-minute visit. So I can come alongside and spend about 45 minutes with patients and really develop that relationship, and it goes a long way.
Interesting. And so it sounds like maybe years ago, maybe that's what people would be talking to their doctors about, and the doctors would have more time to talk to their patients about back in the olden days. But these days, we know doctors and nurses are so busy, and almost everybody, I think, in the medical field. But your position sounds like it's kind of been created with that in mind, that you can spend this extra time if a patient has extra questions or concerns or whatever, to go in and talk to the patient and spend a little bit more one-on-one time with them than maybe the doctor has at his or her disposal?
Yes, that's correct, Scott. In fact, we meet folks through this annual wellness visit, and this is a free visit that Medicare pays for. And this is the time for us to perform some screenings for the doctors and just to go through with a kind of a fine-tooth comb of every little aspect of patients' kind of health as far as like vaccines go, memory issues, fall concerns, safety concerns at home, exercise, eating, medications, just so many different things. And then through that, I can identify patients that maybe require a little bit more help. And then I invite them into a program called Chronic Care Management Services. And now this patient can call me on the telephone. They can come in for a visit and meet with me face to face. And so it creates this opportunity of more touches, more telephone conversations, more face-to-face visits. And I think that's where we end up building this trust, this relationship, to where patients kind of really buy into their plan of care. And then more importantly, they create their own plan of care. And so now the patient is more at the center, and we're creating the resources that they need around them, creating the care plan to what their needs are, to what they feel is most important to them. And that's the key to all of it. Right.
And that's somewhat different, maybe not altogether different, but it seems to me that in the last few years, patients, the public has been taking or been asked to take a more active role in their health care, especially with maybe health insurance and getting more involved with that, or the the marketplace and the Affordable Care Act and all these things that we hear about, and the public having to make some of these choices on their own, hopefully with educated decisions being made. But is that kind of what we're seeing even when they come to see the doctor?
Yes, exactly. We kind of discovered that the patient is the biggest untapped resource. So we've been, giving them all these plans of care with medications and please do this, please do that. But we discovered that, wait a minute, the patient's the biggest untapped resource. What is important to you? And so when we find out what's important to the patient, that might be a little bit different for us. Like, okay, you don't have transportation to your visit. Okay, well, hey, let's get you some resources that can get you that transportation. So it's little things like that we discover about a patient that we didn't always know about maybe in the past. And now we're honing in on, well, what's important for the patient, and now bringing them up to speed with what needs to be done to help them promote their wellness.
Right. And something as simple as transportation, at least for some of us simple, but for some other people, a real big hindrance to getting access to health care or access to a pharmacy or whatever the case may be, or healthy food, who knows, right?
Yes, this is correct. And so many different great resources we have in our community when it comes to different opportunities for food banks or different opportunities for transportation for patients, different physical therapy options. I mean, there's just so many different resources we have in our community, but patients just don't know about. Our senior center is one of the great resources in our community. Our Encore program here at San Juan Junior College, a wonderful program. And so being able to just let patients know about these programs is just a really wonderful thing. And then when they get involved in them, and then you can see their health benefits, it's very gratifying as a nurse.
Right. And so you're talking, it sounds to me like a lot of maybe elderly patients or older patients, but I imagine you deal with patients of all ages, don't you?
Yeah, I primarily do deal with a lot of them. I'm working in internal medicine right now, so primarily my patients are 65 years and older. But I do have a handful of patients, and then our other primary care facilities have family practice settings where very young, teenagers, kids, children, all the way up to the elderly. So they're going to see a wide variety of ages. But I have a certain population of folks in their 30s and 40s that are going through different struggles, and meeting them wherever they're at, and again, just providing the resources, education, and health coaching.
Right. Right. And so would folks maybe see other nurse navigators and in other practices that maybe deal with younger patients or even pediatrics, I suppose, for parents maybe?
Well, we do have a nurse navigator out in Aztec. Mm-hmm. We have a family practice setting in Aztec, and so they see all ages there, so there'll be opportunities there. I don't think we really have anything set up in our pediatrics quite yet, but I think this is what we're going to see as this wave of nurse navigators and population health nurses across the nation. This is getting to be a very big movement, and so it's just going to continue to increase. We started off with one of me back in 2017, and now there's 4 of us. So it's
I thought you were going to talk about cloning,
increase.
that there are now 4 of you, but 4 other nurse navigators.
Actually, Jeff told me that once, that he wanted to clone me.
Right. But that's exciting. So this is really a new concept in healthcare, is what you're telling us. And I think we've heard about it maybe more for inpatients, but as you mentioned at the very beginning of the program, you deal a lot now with outpatients who are coming in just for their regular wellness exam or physical every year or what have you, and forming those relationships.
Yes. I think of something just kind of coming out of COVID right now. We've had a lot of isolation, and so we're seeing a lot of depression and anxiety with our patients. So again, just meeting the need. So as we're moving along, whatever the need is whether nurse navigator can focus their attention and really help our patients.
Right. And you're willing to meet patients face-to-face or virtually or whatever they're comfortable with, I guess. The options are really with the patient, aren't they?
Interesting you asked that, Scott. I've done a variety of different things with my patients. I've met them at appointments, say for a different office that they were uncomfortable going by themselves and not understanding. I've met them in the office. I've done virtual. I've done telephone. So it's a very, I've even talked to nurse navigators across the nation who've actually done home visits. So the sky's the limit.
A house call?
Yes.
A house call?
Yes.
Wow. How about that? Interesting. But that's part of what you're doing to meet the patient where they are, no matter where that is, it sounds to me.
Yes.
And so that's very interesting. Talk to me a little bit more about, some of the things, you mentioned some of the chronic conditions that many folks are dealing with, and maybe that's what becomes somewhat overwhelming is that, I know I'm overweight, and I know I have a risk for diabetes, and I know high blood pressure, and now I have some of these other things that are going on. And for many people, sometimes it may be a bit overwhelming. And so is that something that you help them with as well, to try to keep it in perspective, or at least explain kind of what all this means and how to maybe attack it all at the same time? Because you really need to do that, don't you?
Yeah, so that's a great question. So at the heart of what I do is something called motivational interviewing. And so it's actually not a newer concept. It's been around for a long time, but it's kind of a newer practice for us. Because as a nurse, I've been doing this for many years. Started my career in the Air Force and then went to UNM, graduated there, and we've always developed these care plans, and it's kind of like, okay, here you go, this is what you need to do. But now we're changing the shift to this motivational interviewing kind of thing, asking questions, more open-ended questions, to kind of find out what is it at the heart of what they're ready to do, what they think they can do. Help them start to do something called change talk, where they begin to talk through things they believe they can do or small changes they can make. One small change is going to make a huge difference at the end of the day, kind of thing. And as you have one small change build on another, that's where we can really see a shift and health coming to patients, or joy coming back to them.
Interesting. Because it seems like, to me, and correct me if I'm wrong, that some of this stuff is really habitual, and a lot of folks get into some of these unhealthy habits over 30 years or 20 years or 5 years or whatever it may be. And so we all know breaking those habits is difficult, whether it's drinking, smoking, bad eating, exercising, whatever your bad habit is. And so it can be very difficult to try to change that, even though these very intelligent people realize that unless they do that, their health is at risk.
And you said a key thing there, Scott. Yes, it's difficult for us to change these habits that we've had for so long, but you mentioned that they know, they understand, they know how to make that change. So as I do this motivational interviewing and health coaching with them, it's helping them to just kind of bring up what they already know and begin to create their own care plan, their own goals that they're going to set for themselves on what's going to be the first step. I'll ask questions like, well, if you kind of keep down this pattern or habit, where do you see yourself in 10 years? And they can describe to me some not very good conclusions in that. And then on the flip side, well, if you were able to make a small change today or begin, where would you see yourself? And and then having them talking through that, where they're going to see themselves, or kind of bringing up, well, what's kind of important to you right now? Grandkids are super important. And so sometimes those are very motivational kind of things for patients to want to start to make the change.
Right. And I would think too, like any habit, when you try to overcome that, you do well for a while, and then you might fall off the wagon and then try to get back on. And it sounds like you in your position and other nurse navigators are there for the long run. And so if I do fall off the wagon, you're available to maybe push me back on the wagon, I hope, in a nice way.
Right. So we'll do telephone check-ins, and we've got a nice care plan put together so we can see what goals patients are working on and what goals they've met. And so we'll just kind of check in every now and then and just go through that care plan to kind of remind them of what they're working on. So then they'll describe to me what's been going well, what are the challenges, what are the barriers, and then we just continue to kind of work through those. And it's been a lot of fun to see how some of the patients I've been working with since 2017, the changes they've made and what it looks like today for them. And not every patient has that experience. Some patients continue to not be able to make the changes, but it doesn't change what I do. I continue to come alongside, meet them where they're at, and encourage them and just help them where I can, kind of thing.
Sure.
And that's also been beneficial too, just that they know that there's somebody there for them.
Right. Very important and very different, I would think, for some patients. Maybe they're surprised that you're still there. They're like, oh, right, she's still there, taking my calls and calling me back, right?
Exactly.
That's something that's very new. And so, as we talked about, this is a newer kind of concept in healthcare that is happening here with you. And I imagine you mentioned there are other navigators that are working with San Juan Health Partners. And so this would be a unique feature, I guess, of healthcare, right? When folks are maybe shopping around or looking to see if maybe there's someone like you on staff to help in that journey for better health.
Yes. In fact, I've even talked to some of our community providers, doctors in our community that don't work, necessarily for San Juan, and they are so intrigued by the position, and they're like, well, how do I get someone like you? And I would say to those community members that the nurse you hire will pay for themselves, because we're actually able to bill for our services. And that's kind of a first for me in my career. I've never billed for services. The doctor's always done that.
Right.
But in this position with chronic care management, transitional care management from hospital to home, and with these annual well visits, these are all billable services under the Medicare. And like I said, we'll probably see this trickle down from Medicare to the Medicaid to the private insurances as time goes by. And so you hire a nurse to begin this service, and after a while, the nurse will be paying for themselves.
Interesting. And again, that brings up kind of the business aspect of healthcare these days, is that, you've got to figure out a way to pay for this stuff. And so it sounds like the federal government at least has seen that this is worth paying for. And now it's the private insurance company's turn to maybe step it up and see the same thing.
Yeah, so the whole idea is that if we got a nurse into this kind of a position, will it help to minimize the high costs that patients are utilizing for the emergency room and the hospital? And so data is starting to come out nationwide that yes, indeed, this position is that kind of position that can help identify those patients that are going to the emergency room quite a bit or are getting hospitalized quite a bit. A nurse like myself begins to work with this patient, and then we start to see these small changes and better outcomes to where they're not utilizing the emergency room or hospital as much.
Right. Well, certainly. We certainly understand that if you can stop someone's bad habits or get them back on a healthier track and avoid a heart attack, stroke, whatever, it's certainly going to cost less in the long run for sure. So that makes a lot of sense. Mm-hmm. Very interesting. When you were going to school at UNM, did you ever think you'd be working in a job like this? I mean, you're in the medical field, of course, but is it a little different than what you learned back at UNM?
This is a lot different. My passion was always the emergency room. And well,
that's very different, it seems to me.
Actually, in a funny way, it's not. But I spent many years in the emergency room and loved every minute of it and learned a lot. And I think that background has really helped enhance what I do now. But as the years are going by and the younger nurses are coming out, I'm just thinking, I need a slower pace here. So I started, investigating and searching for a different position. And when this position came about, it was a grant that we had at San Juan Regional. And I just thought, wow, this just sounds interesting, but where do I begin? And so it was interesting getting started. I have a lot of support from our leadership and folks there at San Juan Regional that have just said, Michelle, go ahead and take it, kind of thing. And I learned a lot from a nationwide company called National Rural, and also got to meet with other nurses across the nation several times over the last, or from like 2017, 2018, to learn what they're doing. And then it's basically sharing these best practices. And so there's these websites that I can utilize to share best practices. And now we're actually doing that among each other. So now that we have the other 3 nurse navigators, Shelley, Patrick, and Amber, it's been enhancing for me to make my job or to help me be a better nurse. because now I'm seeing some of the things they're implementing and they're doing, and now we're sharing best practices just right here amongst each other, which is so vital.
Right. Right, very interesting. And so I would imagine maybe there'd be a bit more training involved for some of this as well than what you got from medical school. It almost sounds like you're becoming a bit of a social worker to help maybe some of your patients through some of these more maybe emotional things or other social things that they are having to deal with, as we mentioned earlier, whether it's just getting a ride to their appointment.
Mm-hmm. That's actually a good question. So we're not social workers. We do have social workers in place that are vital in what they do. At the heart of what we do, again, I'll go back to this whole idea of this health coaching and motivational interviewing. So it's getting the patient to understand, what is it that they need to come in and start doing for their own health to help them, achieve their goals, and not just relying on the doctors and the nurses to say, okay, this is the pill you need to take to, make you better. Unfortunately, that just doesn't exist. So it does require a lot of work from our own aspect for our own health. When we're coming alongside in the years as we get older, to keep us independent and mobile. And so that's kind of at the heart of where we're at, to help these patients understand that and continue on that path of wellness.
Understood. And I understand you're not a social worker, but I imagine if someone needed a social worker, you might be able to refer them to that community resource, which is also what you do for that and other things that you encounter, correct?
Exactly, yes. And that is another vital piece of it. So if I'm working with a patient, and again, you mentioned some extra training. Yes, the extra training is this health coaching and motivational interviewing part of what we do. Because I'm not a therapist, although some of my patients think, oh my goodness, you've helped me so much with my depression, anxiety. But if I notice, a patient needs to be connected with that behavioral health specialist or that counselor, that's where I get them, I channel them. If they need that diabetic educator, that's where I get them to. So there's just so many different resources out there that people sometimes either don't know about, or they know about, but they think, cardiac rehab isn't for me. Well, are you sure about that? Why do you think that way? Just kind of practicing that motivational interviewing, and then before you know it, patients are kind of self-talking them into, cardiac, rehab is pretty important.
Right.
So yeah.
Well, and having someone like you that can pull that out of the patient, I guess, maybe to understand what their hesitations are, or why they don't feel comfortable maybe taking that next step or filling out that form to get referred to wherever or whomever.
Yes, that's exactly right, is helping them know and understand the resources, and then, what is it that they want to do as far as the next step for them in their health.
Very good. Well, Michelle, we're out of time this morning, but it's been fascinating to learn about you and the job that you and your colleagues do as these nurse navigators at San Juan Health Partners. And you, again, work with San Juan Health Partners Internal Medicine.
Yes, internal medicine clinic, and I'm just excited for our community that we have this resource available. Patients love it, and I'm dedicated to just being here in our community for the best.
Very good. Well, you may be in high demand, I would imagine, all you and your colleagues. So thank you for coming in this morning.
Thank you, Scott.
It's been a great conversation. Thank you. Michelle Russo, nurse navigator from San Juan Health Partners Internal Medicine, my guest this morning here on KSJE.
Bitcoin is so energy intensive that some U.S.